Thanks so much for joining me on the podcast. How are you today?
I'm great. Great to spend time with you today, Jared.
Let's just dive right in. We tend to keep these short and sweet. So, would first love to hear a little bit about your background and then give us the overview of the company today. I usually tell people kind of focus on that why, how, what, if possible, but feel free to whatever order you want. It's all yours.
Sure, yeah, absolutely. So, again, thanks for having me today. So, as far as my background goes, Zarminali Health is the third startup that I've been a part of. My first one was in the outpatient wound center space. It's a company backed by Bain Cap Ventures that we grew to the second largest provider of outpatient wound center services in the country, and sold it to the only larger group left in the space back in 2015. And then from there, three of us spun out to start what has since become LifeStance Health, which is today the largest provider of outpatient mental health services in the country. It's about 33 states, 7,000 providers, 550 clinics, and most importantly, almost 1 million patients on service at any given point in time. So something who's really proud of kind of building over the past 7 or 8 years. I quite honestly was so motivated by the mission of LifeStance and really increasing access to mental health services around the country. I thought that I would spend the rest of my life doing that. That was up until about a year ago, where my daughter was diagnosed with an autoimmune disorder. And as a family, we were suddenly thrust into this position of having to navigate the pediatric healthcare system and have to bounce around between a bunch of specialists. And what we found was that care, though we were working with some of the best specialists here in Chicago, which is where I'm based, care was very siloed, that the physicians, despite their best attempts, really had difficulty communicating with each other. Nothing in the systems or processes were set up to facilitate good communication. And what we found as parents was that not only was the burden of coordination put on our shoulders, but we were left with an immense sense of guilt as our daughter's symptoms did not improve. And we kept thinking, gosh, are we failing her because we forgot to carry this piece of information from that specialist to this one, or didn't create enough urgency with another one, etc. So the point of saying all that is, for the first time in 7 or 8 years, there was suddenly a very personal mission at hand in saying that there has to be a better way for pediatric care to be coordinated and delivered to not just children like my daughter, who has a more complex issue to deal with, but even just everyday basic pediatric care. So that was really what drove me to start Zarminali Health. It's been about 6 months now. And we've really been off to the races of trying to say, how can we build a single national brand around phenomenal pediatric care that is coordinated, that is multi-specialty focused, that is all about reducing stress on families, and also supporting our pediatric physicians in ensuring that they have an amazing place to work and really do what they went to training for, which is deliver great care to patients.
First off, congrats on everything so far. And one of the coolest things about all the healthcare companies I talk to compared to any other industry is there's always a personal story. It seems like you're usually not building in healthcare if there isn't that personal story, that personal why. So, as tough as I'm sure it is going through that, with your daughter, the eye-opening, like, things that you were able to see,
Oh, yeah.
game changer, right?
Oh, 100%. I mean, it's again, there's something very different about working on a mission that is deeply personal versus just working on something that is theoretical or you haven't personally experienced. And that's one of the amazing things about healthcare generally is not only can you build amazing companies, but the work that you're doing can have a very direct impact on people's lives. And in the case of the last company, it was about directly affecting individuals' mental health care, and again, around 1 million people being touched by the company at any given point in time. In this case, you're not only touching the direct patients, in this case the children, but you're really focused on helping their families, their support network. And so the ability to have a very broad impact is something that I'm particularly excited about.
Now, you recently raised, I believe it was 40 million in seed financing led by General Catalyst. First off, when it comes to investors, getting General Catalyst involved in what you're doing, especially in the healthcare space, is huge. Um, I know that's just kind of an initial milestone, but talk. What does it mean to kick things off like that with an investor? I know you had some other investors too, and feel free to shout them out. But what does that mean in terms of a milestone for helping you achieve your vision?
Yeah, so really, it's a phenomenal milestone to be able to start out with such a fantastic partner as General Catalyst, and more than anything, what we saw in our conversations with both GC as well as others is that the story and the narrative around what we're trying to do really resonates. It's something that anyone that has children immediately can connect with and understand the value of what you're trying to change and create here. So, the funding round as a specific milestone was sort of great reaffirmation that not only are we addressing a significant challenge and tackling a very large addressable market, but we're also doing it in a way that will ultimately help to solve kind of the totality of the issues that the vast majority of Americans sort of face when dealing with pediatric care. Some of the things that I've heard in the past are, well, what you're really tackling is the way that academic centers run, and so what are you doing that's different? And my point has always been, that is true. Really well run academic centers are sort of doing many of the same things that we're hoping to do. The reality, though, is that 80+% of the US gets their care in independent community based practice groups. There's a very small sliver that is really getting care in these larger academic settings. And so our goal is to be able to take some of the great learnings that you see in some of these very well run premier settings that are not accessible to the majority of Americans and bring it to a broader set. So, again, great milestone to achieve, but more than anything, affirmation that we're on the right track, that we've got the right starting team and the right vision to deliver on.
The best entrepreneurs I talk with, immediately when they face a problem, they start game planning, potential solutions, and they realize right away that, I mean, this is why we need to continue to have a mix of insiders and outsiders in healthcare that are building companies, sure, but also it's always crazy to me to see how things can go on as long as they have, and then you realize this, and there's still that opportunity to innovate and make it better. And it seems like out of all industries, healthcare, that tends to happen quite a bit. So
Yeah.
when when you've looked at it, you mentioned earlier the U.S. Pediatric care system is quite fragmented. But as you've been tackling this problem, not just the early stages with your daughter, what challenges have you encountered since like starting the company, and really how have you addressed them to date?
Yeah, so the primary challenge that really anyone has in starting something within healthcare is being able to understand and navigate what is a very complex system. So not only is pediatrics highly fragmented, so you're not dealing with really large groups or sort of sophisticated starting points, particularly those that are not part of a hospital system today. But sort of more importantly is there has been a lack of investment in pediatrics specifically, and I'd say in a lot of different parts of healthcare in totality. And for whatever reason, I think really great talent has been attracted to other industries. And so you've seen high degrees of innovation, obviously in tech, you've seen high degrees of innovation in financial services, and for whatever reason, healthcare, which I would argue is more important to the day to day of anyone's life, has really been a laggard compared to really any of those other industries. And so it's almost embarrassing when you look at things like consumer products, where there's these phenomenal brands and these amazing experiences that are seamless and mobile first. And then you come to healthcare where some people still use paper forms. Getting to through a primary care pediatric visit can take hours for families, even though you're only spending 5 or 10 minutes with a physician. So, again, there's just so much opportunity for improvement, not just within pediatric care, but really broadly across healthcare. So, we're very excited to bring a new lens to the way that people tackle pediatric care specifically. And, I think in kind of selecting our initial partner in General Catalyst, they're taking a very modern approach to many of their healthcare investments and saying that there's a real opportunity to do things differently today than has ever been done before, and applying learnings from other industries to healthcare in very unique ways. So, really excited for that.
Yeah, I love how General Catalyst across these various ventures has been tackling and working with entrepreneurs like yourself to tackle these problems. Very much needed, and it's interesting. I feel like they're doing it at a right time as well, because it seems like people are more open than ever before to actually like we've known for a while our health system across the board needs it needs a better structure. We need to innovate more, right? And it seems like finally things are starting to happen. So I want to ask you really good questions around leveraging the technology. So how is technology helping you integrate primary and specialty care at scale, and really what is that what does the future look like for pediatric care and all that?
Yeah. So the first step is, like we just discussed, is actually very simple, and it's primarily because again, there's been a general lack of investment in technology around healthcare, and so the first step is just building a basic foundation of what it means to incorporate technology into every step of both the patient or family experience as well as the provider or physician experience. So on the family side, it's all about how do you create easier access to your physician? How do you get easier access to your health data? How are you able to schedule appointments with less friction, engage with your provider group asynchronously in ways that just is generally foreign within healthcare today? And so I would love to tell you that the first step is 10 steps forward in technology that's never been seen before. The first step is really just building the basics of saying, let's create a very frictionless experience that will be unique, proprietary, and again, sort of differentiated when it comes to what else is out there when it comes to primary care, pediatric, or multi-specialty groups. On the provider side, that's actually where it gets very interesting, because one of the biggest things that pediatric providers, as well as folks in other specialties, face is this idea of burnout, and the volume expectations, as well as the complexity of the types of patients that folks have to see, even in the outpatient setting, has continued to increase over time. And the reality is that while that burden has increased, so has the administrative work that comes with practicing as a physician. Your documentation has increased, your billing and coding steps have increased, your marketing, you name it. And so a heavy emphasis on bringing technology to reduce the level of complexity for our pediatric providers to even deliver care, so that they can focus their time on interacting with their patients and focusing on their underlying diagnoses, not, okay, did I capture the perfect note in an EMR at the right time? Did I select the right code, et cetera? So there's a lot of low hanging fruit on just the family and the provider experience. As you look to the long term, there's going to be what I believe many innovative ways to introduce technology and the use of AI in ways that can help facilitate those interactions. So think about a family that believes there may be XYZ going on with their child, but they're not sure. They don't want to pull them out of school. They don't want to go in person to a visit, but they want to get a sense of, is this urgent enough where I really should? And so being able to engage with an AI agent to get an understanding of, okay, is this something where I need to really bring my child in, or am I safe to kind of leave them where they are and maybe treat this separately? And so, things that just can't happen today because you have to book appointments with physicians a week or two out, et cetera. And then obviously on the provider side, a lot of similarities on saying there's a way to have a co-pilot sitting with you, moving through the visit, helping you to focus on the things that matter, the things you may be overlooking as a physician, not because you're not great at your job, but just in that moment, in the rush, maybe you didn't think about XYZ, taking all the burden of coding and whatever else it is off your plate. Those are things that, right now, unfortunately, there's not many people doing, but we plan on implementing across our entire tech stack here.
Last question for you as we wrap up here, less 30 seconds. And I really appreciate all the time here today and learning more. Can't wait to continue the conversation in future episodes, and hopefully we can get you to do some additional thought leadership type stuff and keep us
Sure.
up to date. What's next? Obviously, you've covered a lot of ground so far. What's next that really excites you?
Yeah, so what excites me more than anything is sort of our race to scale. And what I mean by that is we have very ambitious plans to grow to a 30-state footprint over the next 3 to 5 years. In the process of that, we're looking to open up hundreds of clinics around the country and start to be able to build out this national brand, which, for healthcare has really rarely been done. What you see is many heavy localized brands that are kind of deep within a single city or a single state. So being able to do a single cohesive brand across the country that people trust for their pediatric care, not just for the day-to-day simple things, but also the more complex cases like I personally dealt with my daughter, is something I'm very excited about. So this is going to be a race, but a fun one here over the next 3 to 5 years.
Well, really appreciate your time here today. Excited to continue the conversation. Thanks so much.
All right, sounds great. Thanks.